Hi, I'm Dr. Wright, Walnut Creek Animal Hospital, and this is a continuation of the video series about teaching a tailgate exam for those new handlers for the specific purpose of being able to address what is, or become familiar with what is normal for your particular hunting class dog or working dog. What this is going to do is facilitate your ability in order to triage these patients in the event that first aid is needed to be administered. So just as a review to supplement the tailgate exam, first we want to observe, so we want to look for mentation of the overall dog. How does the dog travel whenever it comes to us? Are we limping? Are we having an abnormal gait? And then observe for respiration. Is the respiration normal and slow, or rapid and fast, shallow, those sort of things. So before we ever even lay a hand on the dog, we can gather a lot of information. Once we get to the dog and we're closer, we want to look at the dog's mentation. And so what I mean by that is you'll assess what is normal in a personality for your dog, and so things that might be the case. My dog typically looks kind of big, bright-eyed, but sad in general, and so your actual dog may be more bright and inquisitive, and if you see that he's kind of sad, tragic, it might give you an indication that something's wrong and needs to be looked at. Once you get past mentation, then we start looking basically from the tip of the nose, and so we're going to observe the nostrils and the nasal area for a clear discharge. Needs to be the nose needs to be moist and cool. I then open the mouth, and we want to examine the inside of the mouth for any teeth that are broken or lacerations inside the mouth or on the tongue, or any type of discharge that's abnormal from there, blood or pus, etc. So from that stage, then we move to the eyes. That's the next thing back. So we'll open those eyes and make sure that there's no debris around underneath the eyelids or anything. That the white part of the eyes are white and not bloodshot, and that the corneas are clear and transparent to be able to see the pupils. The pupils need to be equal and symmetric, so they both need to be the same size and equally reactive whenever light's passed in front of them. Moving to the ears, we need to have ears that obviously are free of any sort of discharge, swelling, lacerations, foreign bodies, and that they both set on the head equal and hang equal. That's the point in which then I start using my hands more in palpation, and so we'll slide down both front legs, and as we're doing this we want to compare both sides, because basically asymmetry, or something that is abnormal on one side, you might present as a bump with one hand and you don't feel that on the other. So that gives you a little bit of a guide to assess, one side being normal, one side maybe not being normal. Both may be abnormal, but if you're doing this enough, you will become familiar with what is normal. We slide then back across the chest and the dorsal spine and palpate for any lumps, bumps, that sort of scenario, or lacerations. Move to the abdomen. We want to, in the video demonstration, you want to slightly press on the abdomen in both directions and allow the abdominal contents to flow through your hands. And so what we're palpating for there is, one, is there pain? Is there resistance to that palpation? Does the dog become uncomfortable whenever you do that? And two, are there any lumps, bumps, masses, that sort of thing inside that abdomen. Once we come back down the tail and the back legs, now we're once again palpating for symmetry. I always lift the tail to make sure the anal tone is normal, and then of course we can assess the core body temperature. Also moving back up front now to obtain a heart rate. There's two areas to do that that's easy, and one is over the cardiac window, or right behind the elbow on the chest on both sides, and then the other is on the inside of the back, the hind leg, pressing outward from inside out in that femoral artery area to get that pulse. And so kind of brings us into what our normals are supposed to be. Core body temperature, depending upon rest or work. And like I said in the video of the exam, you need to be doing these on both at work dogs and at rest. So you figure out what is specifically normal for your breed and for your dog in particular on that given day. So core body temperature needs to be somewhere between 99 degrees Fahrenheit and 103. The other basic vitals for your dog on the heart or pulse rate needs to be somewhere between 60, 65 up to about 140 should be pretty normal, even on a dog that has been fairly active. The respiration, somewhere between 15 and 45. Some of that can be up to 50, and then of course you have to factor in panting. Are we actually moving air just to cool ourselves, or are we taking big deep breaths or even shallow breaths, in that time frame? So the way to do that, remember, we can count those things one of two ways. Either count the number of breaths or pulse beats in a 6-second window and multiply by 10. That gives you the full number in 1 minute. And same way with the respirations, either every 15 seconds or however many you can count in 6 seconds multiplied by 10 gives you the total beats or total respirations per minute. Capillary refill time, as we demonstrated on the other video in the field, is the blanching of the mucous membranes from pink normal to white and then back to pink. So once we go from white to pink, then that's the total elapsed time that we're counting. And typically those need to be less than 2 seconds. That gives us a lot of information about the cardiovascular structure components of the dog. And that's it. Thank you.